Hi, everyone. Good morning. Today, I am joined by Diane Rindlisbacher, our system vaccine and testing lead for Intermountain Healthcare, to talk about testing in COVID-19. It's been a minute since we've done one of these directed towards just testing. So Diane, thank you so much for joining us. I appreciate it.
Thanks for having me.
Of course. So Intermountain is having some testing changes that are going to become in effect on August 13th, and we wanted to tell the community and public what those are going to be. Can you briefly explain what those changes are that are taking place?
Yeah, on Monday the 30th, we're adding back the ability for our patients and community members to access a saliva PCR COVID test that you can do on your own. The biggest difference on Monday will be that this is a self-service option, which really means individuals can engage using a digital tool found on our website, fill out a screening survey, and it will create an order and send them a QR code via email or text. And then they can choose any one of our locations. In the past, they had to pick a location and a time. And the change on Monday, as we will be adding additional locations, is to make it more convenient for them and, quite frankly, easier for us by having it be self-service and available anytime our building is open. We'll have the last drop-off time be an hour before a clinic closes or an Instacare closes generally, so that we can check in their samples and route them to the lab so that they can be resulted.
And before, we were talking about who exactly should be getting tested for COVID-19. At one point in the pandemic, it was those with symptoms, sometimes it's asymptomatic. Is there a specific type of person who should be getting tested for COVID-19 right now?
Well, to reinforce what Dr. Stenningham said last week on Facebook Live, everybody, if you're feeling ill with cold-like symptoms, should get a test. And there are a variety of tests you can get. He talked about a quick antigen test. You know, if you're feeling ill and you can afford the antigen test that you can pick up from the grocery store, do a quick test. If it's positive, you know you're positive for COVID. If it's negative, you should get a saliva PCR test or a backup PCR test, because that quick, rapid antigen test isn't very good, or it's not as accurate. It's a good test for its purpose, but we need the added accuracy if you have symptoms and are feeling ill and that test comes back negative, or you can just come and have a saliva PCR test. So if you're feeling ill, you should be tested. If you need to travel, need a test for work, need a test for school, or we're exposed to someone that's COVID positive, you should also consider a test.
You mentioned this briefly about the fact that the self-serving test will be a little bit easier on Intermountain staff, but can you explain overall why this switch was made to have this easier self-service testing available?
Well, one of our challenges right now, because of the volume of patients we're treating in our clinics and in the hospital, both COVID and not, is we need to put our caregivers in the places where they can provide the greatest benefit to our patients. And unfortunately, we don't, like other businesses, don't have extra caregivers to apply to added services. And so as we contemplated and thought about how can we improve access to testing, the only way, or the best way to do that, was to make the COVID community testing a self-service option. That means if you're going to come to our self-service COVID testing locations, you need to know a couple of things. First, it's a saliva test. There aren't any swabs provided at our community locations. So you have to be able to produce saliva. The easiest way for you to figure out if you can do that is just take your tongue, put it on the bottom of your teeth, of the back of your teeth, your bottom teeth, and rub your tongue back and forth really, really fast. And if you get saliva at the bottom, just pooling in your mouth, then a saliva test is going to be a good test for you. If you can't do that, then we would advise you to either find another location as listed on the State of Utah website, or reach out to your provider, because we also offer COVID tests in our clinics, in our Instacares, through Connect Care, and if you're really sick, through the emergency department.
Before too, with saliva testing, I know that there was an age limit on who could actually do the saliva test. Is that still the case, that there are certain ages that cannot do this specific test?
It really is dependent on who can fill up the tube with saliva, although the survey that you'll take online recommends that if someone's under the age of 2, to reach out to your pediatrician to be evaluated. The reason that's important, especially as we go into the fall, is there are other respiratory illnesses like RSV, influenza, pneumonia, etc. And you need to think about where's the best place for you to go to be evaluated. And if you're more than just mildly sick, probably best to connect with your
That's great advice. I know that we were talking to someone from primaries around RSV a couple weeks ago, and they mentioned that that is on a rise right now. They can test for it as well as COVID, but there are multiple things that they need to do. So that's important to know if your child is not just having minor symptoms, to make sure you talk to your pediatrician.
Amanda, it's also important to know that a saliva test only tests for COVID.
Mm-hmm.
Where some other tests, if you need to connect with your provider, they can test for influenza and COVID and other diseases at the same time.
That's probably great too, as a child, to not have to take more than one test. I'm sure that is super helpful. And with those nasal tests too, is there any reason besides that I can't produce saliva that I would have to take this test? Besides, like, is there an advantage to this test versus the saliva test, I guess?
Yeah, well, no test is perfect and no sample collection method is perfect. We generally reserve that long, deep swab that goes to the back of your nose, almost to your brain, for those patients that are in the hospital or the emergency department. But in an outpatient setting, a saliva sample's good, and a nasal swab just in both nose that doesn't go as deeply into your nose is also sufficient for us to determine whether you have COVID or not. So if you can't produce saliva and you've engaged with your provider, we can also figure out what the best sample collection method should be for the situation.
Something else too, which you briefly touched on, is travel. There's different requirements for different places. If you're entering the US or leaving again and need a test, make sure you're checking what that country or place requires. I know that some places require different things or will take everything. So that's super important. If you're not sick and just getting tested for travel or work or something like that, make sure it's what you actually need to get to, which is important.
And that may mean that you can't come to our community sites. You might have to go somewhere else. For instance, if you're going to Hawaii, many of you already know you can't come to an intermountain location. If you need a deep nasal swab for travel, you'll need to go to a different location because we don't offer that in our community self-serve location.
Yes, and another thing that I constantly hear people talking about is trying to figure out what variant they have, if they have COVID, and what our tests can actually tell us. Can you kind of break down how that process works?
Well, when we do a COVID test, we're testing for the presence of the disease, of the virus. Do you have it? Yes or no? That's really what this test does. To know what variant it is, has to be genetically sequenced. And not every test is genetically sequenced and doesn't need to be in order to provide good care or good instructions. So while Intermountain Healthcare doesn't do that genetic sequencing, we partner with the Utah Department of Health, and they do a sampling of samples that they'll genetically sequence because it takes a lot of effort. We also know that the virus variant that is in the community is by and large the Delta variant. And so we track that with the Utah Department of Health. And we know that if you get COVID right now, 99% of the time, it's going to be the Delta variant. So we don't need to do the sequencing on every sample.
From an infectious disease standpoint too, as a consumer, does it matter what variant I have, I guess? Like, do I need to personally know this knowledge? Will that change how I'm treated or anything of the like? Or should I just know I have COVID, I need to follow these precautions?
You just need to know that you have COVID, right? And the treatments will be adapted to you know, who you are and what comorbidities you might have. If you have asthma and other things based on your age, your provider can, with our teams, evaluate, with our infectious disease teams, evaluate if there are treatments that can help you. That's why it's so important when you're first beginning to be ill to get tested early, because some of those treatments, if you're eligible, are only effective within the first 7 days, which is another reason why we felt motivated to increase access to testing and make it a little easier so that if needed and if you're eligible, you can connect to treatments and stay out of the hospital, hopefully, if you get those treatments and are eligible.
That's one reason why testing is so important. Can you talk to us about other reasons why getting a test, even if you have really mild symptoms, is so important?
Well, you know, what you do around your family if you have a cold might be different than what you do around your family if you have COVID. And we don't want you to get your grandparents sick or your aunts and uncles or your parents if you're a kid, and your friends and your neighbors. We really want everyone to stay healthy. We want people to stay out of the hospital. The best way, of course, to do that is to get a vaccine. But if you're feeling ill, please get tested.
Is there anything else you want to mention to us today around testing or anything we've learned in this process over the last 18 months as well?
Well, we learned early in the pandemic that queuing up a lot of cars in line was really painful for you, and it was painful for us. I admit we're a little nervous because on Monday we aren't having you pick a site or a time, but we think that if we add a lot more locations, that you can individually pick a site that's closest to you rather than just going to the ones over the last year you've gone to. We're going from about 25 sites to over 60 locations. We hope all of them will be ready on Monday. Some might come online a little bit after Monday. When you schedule your test, you'll get a list and you can just pick. It doesn't matter to us which one you go to, but we would ask you to not just go to the natural ones you've always gone to. Please spread the opportunity amongst all of our locations. That will help our caregivers. And if you happen to arrive and there's a line, please socially distance while you're picking up your kit. Please go to your car or take the kit home to collect the sample, and then you can drop it back off at your convenience.
My last question for you actually is around results. Previously, people could get results in a couple of different ways. Can you just emphasize and retell us how to get those results of that test?
Well, for this digital self-serve experience, it's a digital experience. So your results will come to you digitally through our My Health platform. If you've given us your mobile telephone number, you should receive a text. We won't be calling you with your positive or negative result. And for those that struggle with the digital platform, there will be instructions on the kit when you pick it up that tell you how to get your results, and there will be a telephone number that you can also call for results.
That's great to hear. Well, Diane, thank you so much for joining us and giving us this update. And to anyone watching, our COVID-19 testing website will be updated hopefully early Monday morning for you to get all the information about locations and testing sites. We'll make sure to post a link on Monday where you can find all of that, and hopefully that makes testing easier for our community. And again, Diane, thank you so much for joining us, and we'll talk to you later.
All right, thanks, Amanda.
Thanks.